Our next speaker is Maria Hansen, who's going to be presenting levels of physical activity amongst patients hospitalized following hip fracture and the risk of readmission and mortality, a prospective cohort study. Thank you very much.
Thank you for letting me present our study, which is the first study in Hip Me Up research program. I would like to start here and present you to Jens. He is 72 years old. He broke his hip. As a physio, we know what to do. We should provide early mobilization, and we should also offer him frequent physiotherapy and ambulation. Previous studies concerning physical activity during acute hospitalization were done about 10 years ago. And they tell us that time spent in upright position is quite low. So Jens will probably spend most of his time in bed. Therefore, we were curious to investigate present levels of physical activity for Jens and our patients. We also wanted this baseline to include a broad representation of patients, also including patients with cognitive deficits and patients that do not speak our own language. Yes. Secondary, we also wanted to investigate the association between physical activity and the risk for readmission and mortality. Physical activity was measured using an activity monitor. Data were collected at 2 hospitals. The monitor was then removed at discharge, and 30 days after, we viewed the patient records. 101 patients were included, a majority on the first post-operative day. The monitors were removed around day 7. And here are some basic demographics at inclusion. Viewing the NMS and KES score, we can see that most of the patients were independent in basic mobility activities pre-fracture. Looking at the OMC score, we can see that most of the patients were below the cutoff for cognitive impairment and also at risk for malnutrition when looking at the MNA score. 9 of the patients had another ethnic background than Danish. Let's take a look at the activity outcomes. Upright time is the variable where time standing is added with time walking. And we can see that it increases during the post-operative days, being at most at day 6. Looking at time walking for itself, it also increases and is also at most at day 6. To compare our data with previous studies should be done carefully, since samples, devices, and methods for reporting, they are different. But to put our data in some perspectives, let's take a look at 2 previous studies investigating physical activity during hospitalization. First out, we have Kronborg et al. From our own hospital. They reported 42 minutes. Then we have Tarelsen et al. Here in Norway. They reported 52 minutes. And our result is 24. For me, this looks like a negative trend. I will get back to this in just a moment. Looking at the association with mortality, we did not conduct this analysis since our levels was way below the national levels. We did not see an association with readmission, probably since readmission is a sum of many different factors. Okay, let's wrap up. Today, we do have evidence promoting physical activity during hospitalization. Here are some examples. It's both regarding patients with a hip fracture, but also for elderly in general. And for me, it looks like a negative trend, where the focus on physical activity is increasing, while the levels of physical activity is decreasing. We knew before that the levels were quite low, but as it looks like at the moment, it calls for action. Therefore, we have developed Hip Me Up research program. We would like to try to understand and explain clinical practice regarding basic mobility, physical activity, and exercise in order to get in-depth knowledge. I believe that is the first step towards an improvement to our patients. Thanks for listening, and thanks to my fantastic co-authors.
Thank you very much. Again, really nice and clear presentation. Again, we've got a couple of minutes for any questions from the audience. Please don't be shy. Come forward. Again, if just while we're... sorry, yes, please do.
What do you think, why is it this negative? Why do patients die more than, is it because they are more ill, or is it because we have fewer nurses, or they are more busy, and do you have any theories?
Yeah, and that is what I will bring in the next couple of years to understand, because it's for someone else, not in our area, it looks so simple. Just to get the patient out of the bed, should it be so challenging? Yes, it is. Yes, we have less resources, and they do not seem not to increase. So resources, is it professional roles? Who has we can see among, for example, medical patients, who has the responsibility for having the patients going out walking? Is it the 15 minutes physio daily? But what are the other professionals' responsibilities?
But it's also very low measurements, like common rooms with TVs, instead of having TV in the room.
Exactly, they don't have to move. Yeah. And so I think it's many different things. In the next study, we will go out and observe clinical practice to look at those issues, maybe not always reported in the quantitative studies, but to look at also the environment.
So thank you. May I just ask one really short question? Did you look at the time to theatre versus physical activity? So that was, did patients who were waiting longer to have an operation, were they walking less, as opposed to people who had, say, surgery on the day of their fracture or the day after?
You mean time to surgery had influence on the physical?
Absolutely, yeah.
I didn't have that outcome, unfortunately.
Okay, thank you very much.
Thank you.
Thank you ever so much.